Welcome. My name is Dr. Mario Leyba. I'm a general and robotic surgeon here in Albuquerque, New Mexico. We're going to discuss several things today, specifically regarding patients, how to care for them in surgical wise, and how to make you feel more comfortable. I'm going to see you in my clinic. We're going to talk about things, but today we're going to give you some information so you can process, so when I see you later, we can have a good discussion. The reason for making these videos was to help the surgical process along. I've seen it from a surgical standpoint. I know how to do the surgery, I've seen it in clinic and so forth, but I've never really dealt with being a patient. And when patients come to my clinic, oftentimes they're overwhelmed with the amount of knowledge that I give them and other doctors, and they focus on that rather than listening to what's actually going on. So when they go home, their family members ask them, well, what happened? A lot of times they're like, I don't remember anything. So the reason for this is to help educate patients and family members and even providers and other people that want to be involved in the surgical procedures themselves. I do surgery for colon cancer, diverticulitis, tumors, colovaginal fistulas, or other intestinal surgeries. What are the symptoms of colon problems that require surgery? Symptoms may include intermittent abdominal pain, nausea with or without vomiting, bloating, occasional diarrhea, weight loss, and/or rectal bleeding. These are usually found on imaging studies or on colonoscopy or examination. These symptoms may need elective surgical consultation and typically resolve with surgery. Advanced colon or intestinal disease may also include intestinal blockage, infection, vomiting, bleeding, and may need acute surgical intervention in the emergency department. This diagram shows your colon. Diverticulosis typically affects this part of the colon called the sigmoid colon. Diverticulosis have pouches. These pouches subsequently become inflamed or infected, causing diverticulitis. The typical surgery for diverticulitis is removal of this portion of the colon called a sigmoid resection. This picture shows the various possibilities during colon surgery. Depending on the location of the tumor or problem, surgery can then be completed to remove that. In this section, the right side shows the problem and the after surgery shows how it would be reconnected. Left-sided tumors, sigmoid tumors, and low-lying tumors can be dealt with in various methods. Who is prone to colon or intestinal problems? Both men and women who have been found to have a colon cancer, colon diverticulosis, tumors, or suspicious features of colon problems need colon surgery. How is a colorectal problem treated? Elective surgery is easier and less risky than emergency surgery. How is colon or intestinal surgery done? Colon surgery can be done by several methods, including robotic, laparoscopic, or open techniques. Most patients will remain in the hospital from 3 to 5 days, depending on the method. Each method has its benefits and risks and are tailored to each patient. I usually do a robotic technique, which involves filling the abdomen with air and removing the colon segment using very small incisions using the Da Vinci robotic system. The type of surgery is chosen depending on each patient profile. What are the benefits of robotic surgery of the colon? As I mentioned earlier, I know how to do all of the techniques for colon surgery, including laparoscopic, robotic, and open techniques. I use a robotic technique for colon surgery because in my hands, it gives me several things. Number one, smaller cosmetic incisions, with rapid healing and improved pain profile. Ability to evaluate the colon or intestinal blood supply intraoperatively. Superior visualization at the time of surgery with high definition, three-dimensional visualization. And more versatile surgical arm movement compared to laparoscopy. Number 4, the ability to evaluate intra-abdominal structures such as the intestine or ureters prior to resection and anastomosis of the colon. Is robotic surgery safe? Absolutely, it is very safe. It is one of the most common surgeries that I do. I have done the most robotic colon surgeries in all of New Mexico. In larger cities, it is rapidly growing as the preferred method, especially amongst advanced, minimally invasive surgeons. What are the risks of surgery? All surgeries have some degree of risk, but surgical risks include, but not limited to, bleeding, infection, colon anastomotic leak, wound complications. These complications are not common and occur more with emergency type surgery and long-standing disease.